TF-CBT is a short-term trauma-focused therapy for children, so ages around 3 to 18, and it's a way to focus on a trauma or traumas that the child may have experienced. Again, it doesn't matter what kind of trauma, just that the child feels traumatized by that thing. And it helps give them what I call a toolkit for dealing with the trauma itself, but also moving forward in their life. I think we all can use coping skills and relaxation techniques. So it gives them that. It gives them a space to process what has happened with them. And it also gives them a chance to look forward to the future, look forward to their healing journey, and help safety plan for the future. The TF-CBT model is short term in that there's a beginning and an end. It's not like other types of therapy where you might be seeing a therapist for years and years and years. And so it is really focused on that trauma or traumas that the child may have experienced. And the type of trauma isn't necessarily relevant. It's more so that the child feels traumatized by that thing that has happened to them. It stems from cognitive behavioral therapy, which is very common in the counseling and therapy world. It is a modality that is utilized for survivors of trauma and survivors that are children and teens. So it's split into 3 components or 3 phases, if you will. The first focuses on like psychoeducation, relaxation techniques, those sort of things. And then the second part, which is kind of the bread and butter, or what TF-CBT is known for, is the trauma narration part, which includes creating a trauma narrative and then the child sharing that with a trusted adult, which is oftentimes a caregiver. And then the third phase is safety planning, revisiting anything that the child might need, and then preparing for termination and graduation. I think giving the child time to where they feel ready and can express feeling ready. When I start doing TF-CBT, the first session or 2, I explain that whole treatment plan, the whole process, what it looks like, what a trauma narrative is, so they know what they're getting into. So if they were to tell me, I do not feel ready for that, exploring that as in, okay, well, that's the second part. So if we take time to work on like meditation or talking about your feelings and how to talk to others about your feelings, we'll eventually get to that point with the trauma narrative. Is that okay? And if the child is still like, I am absolutely not ready for that, I can't even think about that, then I don't think it would be a good idea to engage in TF-CBT. But I think giving a child the skills that TF-CBT offers and also helping them to process, that's what the trauma narrative part is. You're helping them to process what has happened to them very actively, and it can be more intense. So you don't want to go into it with a child that is not willing to do it. But I think it sets them up for more long-lasting healing in the long run if you start as soon as you can. So if a parent is really wanting their child to undergo TF-CBT, but the child makes it known that they're not ready for it, I would not go for it. I mean, I would sit down with the child again and explain what TF-CBT looks like. I would answer any questions they have, give them examples of kind of what kind of stuff we would talk about, what activities, what skills they would learn, and also give them examples of the trauma narrative process, kind of bring up examples of what other kids have done for their trauma narrative, what that looked like, and see if that doesn't kind of help with any of the apprehension they might have. But if they're still adamant that they don't want to do it, then I would just tell the parent that they're not ready. Also, TF-CBT really harps on caregiver support. If a kid doesn't feel comfortable coming to their parent about things, they're less likely to be vulnerable with them. They're less likely to disclose any abuse or any trauma that they might have experienced that the parent isn't aware of. And I think that's really essential for the healing process moving forward, for the child to have that support at home. I often say sometimes the most difficult part in working with children is coordinating with parents. coordinating with caregivers or foster parents or what have you. Their work schedules can be hard to kind of work around. Again, that TF-CBT caregiver engagement is best case scenario. So sometimes if you don't have that, not that the treatment isn't effective, but it's not at the level that we would hope for.